What are the types of CAR T cell therapy products used in treating diffuse large B cell lymphoma?
In the DLBCL space, we currently have three different types of CAR T cells that are FDA approved. And the FDA approved agents include Axi-cel or Yescarta, Lysocell or Breyanzi, and Tisa-cel or Kymriah. These are all approved for the third-line setting in large cell lymphoma, but Axi-cel and Lysocell are approved for the second-line setting in the disease.
What is axicabtagene ciloleucel, or Yescarta?
Axi-cel is the first product among all these CAR T products that are now approved for large cell lymphoma that was first approved for the disease in the third-line setting. Now it has second-line approval as well. So this is a product that's what we call as a CD28-based CAR T. So functionally, it is slightly more rapidly expansive inside the patient's body. And some of the initial side effects that we experience after CAR T cells are slightly more pronounced with this class of CAR T cells. But it's a very effective product, and the cell manufacturing is also much faster with this product compared to the other two. On an average, the cell turnaround is now between 14 to 17 days for the T cells to come back to the patient site. So overall, we have Axi-cel now approved in second line and third line setting. There are ongoing efforts to even in some institutions, Axi-cel can also be done as outpatient therapy. But here at our institution, we at least hospitalize the patients for a few days after Axi-cel to monitor for any side effects.
What is lysocabtagene maraleucel, or Breyanzi?
Lysocell or Breyanzi is the second product that got approved for this disease, and it also has approval in the second line and third line setting. So Lysocell, how it differs from Axi-cel is that co-stimulatory domain or one of the pieces of the CAR receptor is not CD28, but it's what we call as 41BB for this product. So it has a more gentler expansion and a smoother peak compared to the rapid peak with Axi-cel in the patient. Turnaround time is slightly more, around 3 to 4 weeks for this product, but much more safer, especially if you have a slightly more frailer elderly patient, then we tend to prefer Lysocell over Axi-cel. Again, there is no head-to-head comparison in a randomized fashion between these products, and so we can't really say one is superior to the other. Both are extremely effective, and both have both second and third line indications for large cell lymphoma.
What is tisagenlecleucel, or Kymriah?
So Tisa-cel or Kymriah is another 41BB CAR T. It was initially approved along with Axi-cel for large B-cell lymphoma in the third line. But unfortunately for this product, in the second line study, where that was compared against standard of care and bone marrow transplant, this product study did not meet the endpoint. So it still does not have a second line approval. So Tisa-cel currently is more used for other lymphomas like follicular lymphoma and acute lymphoblastic leukemia. In the large B-cell lymphoma space, in the third line setting, it probably has a role, but Tisa-cel is likely making a comeback with a more advanced version of itself, which is called as a Rab-cel, and that possibly may become more standard of care very, very soon.
What do you need to know when deciding on a specific CAR T cell therapy?
Between the three, I think at least one thing is clear. For large B-cell lymphoma, Axi-cel and Lysocell look to have a slight edge over Tisa-cel, and that's been proven in the second-line setting. Between product comparisons, as I said, in a randomized fashion has not been conducted. What data we have right now are like looking back in the real world in retrospective analysis or comparing cross-trial comparisons, which are always not comparing oranges to oranges. We're doing apples to oranges comparison. But between Axi-cel and Lysocell, for sure, they are very effective agents in the second and third line setting. And to choose between a product, what a patient needs to know, it all depends on what the treating physician